Hey guys, I'm Dr. Beth, an osteopath here at Melbourne Headache Solutions. And today we're looking into Big Pharma and their latest migraine medication, erenumab, which is a CGRP antibody. So, is it worth all the hype? Or is there something better out there that can treat your headaches and migraines? So, I'm going to answer both of these questions in this video. But on that note, I love questions and encourage questions. So if you've got any, drop them below and I'll get back to you. So, CGRP stands for calcitonin gene-related peptide. And for a while now, we've known that the underlying disorder in headaches and migraines is brainstem sensitization. So the lower part of the brainstem, the trigeminocervical nucleus, is housed in the upper cervical spine. And when it's sensitized, it creates and releases CGRP. And in chronic headache and migraine sufferers, CGRP levels are elevated all the time, not just during a pain attack. However, if you inject CGRP into non-migraine sufferers, you couldn't induce a migraine. So to me, this just tells me that CGRP is a piece of the puzzle and not the whole puzzle. However, if you do decrease the CGRP levels in headache and migraine sufferers, for some people, they did get a decrease in intensity and or frequency of their symptoms. So, what researchers did is they created an antibody which selectively binds to CGRP to decrease those levels within headache and migraine sufferers to bring their CGRP levels back down to a more normal state. However, it's still just targeting symptoms. It's not targeting the cause because, as I said, the CGRP levels are just a piece of the puzzle, not the whole puzzle. But why all the hype? It is the first and only, so far, migraine-specific medication. Previously, headache and migraine sufferers had to take medications that were not designed for them. So they were taking beta blockers, anti-epileptic medications, antidepressants, and they came with some pretty shocking side effects. So we're talking weight loss, weight gain, hair loss, headaches, pins and needles, fatigue, vagueness, all sorts of things. And for most people, they couldn't tolerate the symptoms. It was making things worse for them. So what's pretty exciting about this medication is that so far, and we're talking so far because it's still relatively new, it's been well tolerated. So that's why it's been so exciting. But on the flip side, this medication needs to be injected monthly. And with those monthly injections, it comes with a pretty hefty price tag of $750 to $850. And what we do also know is that it only decreases your headache and migraine symptoms by 50% in 1 in 6 people. So, is it really worth the hype? The answer is no. So, it's only targeting your symptoms, and it's not really better than any of the other migraine medications out there in terms of reducing your symptoms, except for the fact that it's better tolerated by people. So why are we just treating the symptoms when we could be treating the cause? Doctors are more and more acknowledging the role of neck pain in headaches and migraines. And neck pain is actually the single most common associated feature of a migraine, even more so than nausea. So, as I mentioned before, the lower part of the brainstem is housed in the upper part of the neck, and chronic dysfunctions in this area can lead to that sensitization of the brainstem. Now, traditional manual therapy and its techniques are specific to neck pain. However, there are others of us that are trained in specific headache and migraine techniques, such as the Watson headache approach, that are addressing the underlying dysfunction in headaches and migraines, which is that brainstem sensitization. So why treat symptoms when you can treat the cause? I hope you found what I've gone through informative today, and as I said, I love questions, so if you've got any, please drop them below. Thanks guys, I'll catch you next time.